Hi, I'm Dr. Charles Livingstone. I work at the School of Public Health and Preventive Medicine. I am a senior lecturer. I also do gambling research, but I do a lot of teaching. I've been doing gambling research for nearly 20 years. I started in about 1998. My PhD was focused on what I call the social and political economy of gambling in Victoria, particularly poker machine gambling. And what I've discovered over the years is how poker machines work, why they do what they do, how they are regulated, or in my opinion not well enough regulated, how they cause harm, what the nature of those harms is, how the gambling industry, like the tobacco and the alcohol industries, interacts to influence government and affect the way they make decisions around policy, and how public health has a responsibility to understand the harms and work out how best to prevent and minimise those harms. So my work is really focused on understanding the nature of gambling harm, understanding how gambling operates to cause that harm, and coming up with public health based ideas in order to circumvent that harm, to prevent it and minimise it. Well, I think, the career highlights for me are many and varied, and they come at a rapid rate. I mean, every time you publish an article in a serious journal, it's a wonderful career highlight, and happily I've had that experience a few times. When you get invited to collaborate with world-leading researchers on policy books, which I'm currently doing with a bunch of people from well-established careers from North America, Europe, Australia, New Zealand, etc. That's a wonderful experience when you're mingling with people who are your heroes. When you're on first name terms with some of the world's most preeminent researchers, that's a pretty big highlight from my point of view. When you publish a document which is on an official Australian government website which tells people how poker machines work, that was a career highlight. But really the biggest career highlights I get is the incredible enjoyment I get from seeing PhD students get through, do well and produce good articles. All right, well, last year I was lucky enough to get a grant from the Victorian Responsible Gambling Foundation to work with a bunch of really experienced public health researchers from different fields. So Professor Ron Borland, who works at the Cancer Council, who's an international expert par excellence on tobacco control. Professor Robin Room, who's at La Trobe these days, but who is again a world-renowned expert on alcohol policy. Ben Smith from Monash, who is one of Australia's leading researchers on obesity and physical activity, and people from the Burnet Institute who are really leading researchers on bloodborne virus control and so on. So what we're doing with that is we're looking at all the successes and some of the disappointments that have been associated with all of those areas of public health. Some of them have been spectacular successes, such as tobacco control, some less so. And what we're trying to do is learn what lessons we can draw from that experience for improving our interventions to minimise, prevent harm in the gambling space. So that report is still underway. It's a labour of love, even though it's very intense, and I'm really, really excited with the prospect of that report coming out later this year or early next year. And the other thing that I've been working on, which has been really exciting, is a paper I wrote for the Australian Gambling Research Centre, which they commissioned because they were kind enough to think that I had the expertise to tell the general community in Australia how poker machines actually work, what they do, what their tricks, what their bells and whistles are. So that was published about a month ago. It was accompanied by a webinar, both of which are still online if you Google Australian Gambling Research Centre. And this attempts in reasonably straightforward language to explain what the principles of poker machines are, how they've been accentuated by the various tricks that the industry has invented, and how they can be addictive and how they can cause harm. But also it moves to some of the solutions which, because we now understand these technical characteristics better, we're in a position to start talking about and hopefully implementing with, of course, as always, the intention of reducing the harms associated with gambling and in many cases preventing them, always with a focus on public health benefits.